portion of it. I'm just going to go over infection prevention, which is very important in our facility. That's how we keep our patients safe. Here are our objectives. We're going to review basic infection prevention and control, the importance of hand hygiene, review of isolation precautions, which has really changed and amidst the COVID-19 stuff. Review isolation precautions, PPE, what kind, for which situation, and other ways to prevent disease transmission. We're going to review exposures, and that's all part of what Des talks about. So back to the very beginning, the human body is comprised of about 30 to 40 trillion cells. So every time we move, every time we do anything, we're shedding these cells. So that's why it's really important to keep ourselves as clean as possible. There are some areas that are required to have long sleeves when you're doing things, particularly like in the operating room, central sterile, those areas. So we're more like Pigpen than we think. The chain of disease transmission, we learned this basics biology. So at any point in time that we can stop that chain of disease transmission, we're the winners. We win. And a lot of times that's just by washing our hands. So you have the infectious agents, the little reservoirs, the portals of entry, your nose, mouth, any mucous membrane, your eyeballs sometimes, your modes of transmission, coughing, when you're out in public. That's why this distancing with COVID-19 is working so well. Portals of exit, so how the infectious disease gets from me to you. And then the susceptible host. So we probably learned about this in school. That's okay. But we're doing it for everybody else. Mm-hmm. Oh, goodness, make myself dizzy. And so, how do we break the transmission cycle? So it can be any one of these little chains. Once you take that link out, it just can't go from the next. So washing our hands, covering our cough, making sure that we're wearing the correct PPE, keeping our patients as healthy as we can, getting up soon, walking, all of those things. Hand hygiene is the most important way, the cheapest way, and the most effective way to help keep our patients safe. So we require everybody, before they're entering and when they're leaving a patient's room, between dirty to clean patient care activities, before putting on gloves, after taking off gloves, after touching any equipment in the patient's environment, like the bed, the laundry, the IV, the little table that they have in there, before inserting any device, so hooking up an IV, doing any of that stuff, before giving or preparing medications, or before giving food, and after using the restroom. So personally, I equate hand hygiene and not performing hand hygiene as severe as a medication error. So when I go walking around and I'm doing the hand hygiene surveillance, I let people know that that's why I'm here, and that's what I'm doing. So they get that hand, and that's kind of funny, hand-eye coordination. And
it is, it's like muscle memory.
Yeah, it is. And so, there's Noreen, gotta wash our hands. You know, so I think it's really important to have a lot of conversation, because if we're talking about it, when the surveyors, when Joint Commission comes, they're going to know that that's foremost in our mind. I'm not going to sit there and watch somebody walk into a room and not do hand hygiene. I wouldn't let you do a med error, so I'm not going to let you not wash your hands coming in and out of the patient's room. We'll see if we can get this to play. Sometimes it does, sometimes it doesn't.
Very important, I follow on. Hand hygiene. Always wash in after you've touched the patients. I use a little bit of this, and then I make sure to count the imperial march. Dun, 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 dun. Okay, that's way too long. I might have miscalculated. Maybe just, happy birthday twice. But make sure to wash your hands, because otherwise you will spread pestilence throughout the galaxy.
Yeah. So it's a little fun there. So we have hospital-approved hand sanitizers and approved soap and water for our hand hygiene. And that's based on evidence-based, so make sure that it's going to kill everything that we need it to kill. Use hand sanitizers when your hands aren't visibly soiled. They're alcohol-based and they have a greater kill efficiency than soap and water. Use soap and water when you have a buildup of hand sanitizers on your hand. I can go about 5 or 6 uses of the hand sanitizer, then I have to wash my hands. When your hands are visibly soiled and after caring for a patient with C. diff or norovirus, because they're spores and sanitizers will kill that. So we do not wear gloves in the hallways. You know, we don't. There are times when you're going to wear your gloves in the hallways, but just for overall general use. No gloves in the hallways. You use them for your patient care activities, and then doff them, and then hand clean. We don't use artificial nails. That includes the gel or shellac. Nail polish is okay as long as it's less than 4 days and it's not cracked. Okay. Your fingernails are supposed to be 1/4 inch long, and we already talked about the nail polish. So look at there. Picture of acceptable fingernails, because your fingernails get really gooey underneath. Standard precautions. We use standard precautions for all of our patients. For all of our patient care, we assume that everybody has the little uber goobers, and so we want to make sure that we keep ourselves safe and the next patient safe. So we use standard precautions with everybody. If somebody has a copious wound drainage, what would you use? You use gloves, maybe goggles. With the COVID-19, with the SARS-CoV-2 virus, they found that it can be transmitted through all mucous membranes. So they're really starting to put goggles in there now also. So these are just some of the different things that you can use. See, isolation. We have Contact Plus, Droplet Airborne. So we use standard precautions for all of our patients. And then you can have standard plus contact. So if you have to touch, contact is if you have to touch the contaminated person or object. So that would be like MRSA, those kind of disease. Contact plus would be for like C. diff. So you have your contacts. So you want to make sure you have your gloves on and your gown. You want to make sure you have a mask on. Droplets are spread in the air in large, heavy drops. And airborne is spread in the air of tiny suspected particles. So we have different resources. Isolation guides by disease is a quick reference. By the CDC guideline, this should be your first go-to. We've attached it to the Lippincott isolation policy. And so it shows all the drugs. So if you have somebody with chickenpox, it shows you tells you which precautions to use. What do you do next? You order the isolation, you get the PPE, and make sure that it's available hanging outside the patient door. Place the appropriate isolation sign on the door, and educate the patient and visitors. It's really important when we have those patients that the isolation sign gets on there quickly, because we have respiratory, we have EVS, we have dietary that are all going in and out of that room, and we want to make sure, or they're not going in and out of the room because they are on isolation. So here's contact. We use the little brown sign, contact precautions there. Gloves and gown for patient care, dedicated equipment. Always do hand hygiene before and after. No gloves outside the patient room for this. Again, Contact Plus. We use this for patients with confirmed or suspected C. diff or norovirus. So this is like contact precautions except for the certain cleaning details. So instead of hand sanitizer, you use soap and water for your hands, and EVS knows to clean with bleach. That's the big difference there. say droplet precaution. Droplet precautions are used for respiratory viruses like influenza, parvovirus, mumps, now COVID-19, respiratory bacteria, like pertussis, diphtheria, whatever that other word is, I hate that word, and meningitis suspected until organism is identified, confirmed for Neisseria meningitis. So you use the droplet sign for the door, surgical mask and eye protection. You always do hand hygiene before and exiting the room, and you remove the PPE before leaving the patient room. Airborne is a negative pressure room with the N95 mask, and you've been fitted for one? Okay.
How many negative pressure rooms do you have?
What was that?
11, how many pressure rooms do we have, 11?
There's a lot.
Yeah,
A lot.
yeah,
There's a lot. If you're in an area that has one, you'll know about it.
yeah, there's,
She's in the sleep lab.
That's the three.
yeah. Reverse isolation, we don't, I gotta take that one out, we don't even use that anymore. Cover your cough, minimize, or keep your immunizations up to date, don't come to work when you're sick. Get an employee health evaluation. I'm not sure what that picture is. Help stop the spread of swine flu and other dangerous organisms. Washing hands. Just here. And now I'll give it to Liz. Thank you and welcome.
Thank you.
Thanks. You brought up the same. Yeah.
You met me already.
I did.
Nice to see you again.
Good to see you too.
So your question about isolation rooms, so the hospital has a lot, and there's a lot of rooms in the hospital that can be turned in, not isolation, negative pressure
Negative
rooms.
pressure rooms, yeah.
There's a few that can be, glad you got that on video. That can be turned into a negative pressure. Mainly we have like 2 almost in every unit, so like 2 on med surg, 2 in ICU. There's 2 in the emergency department. So we have quite a few. I don't think your area that you're going to be working in has any. Okay, so exposures. So anytime you are exposed to someone else's body fluids, whether or not, I'm just going to make this big if it'll work. Nope. Oh, hey. Does our computer not? Oh, it's frozen now. I just tried to take it off
Did it too
the,
fast.
so that it's like the presentation
Full
view,
screen.
not. Anyways,
Maybe if you, oh, there it is.
okay. I didn't like what I was doing. Okay, so anytime you're exposed to someone's body fluids that aren't yours, you should come and be seen because those can always be potentially infectious. So wash the area. We've got a policy on who you notify, but essentially it's your immediate supervisor. If it's after hours, the house supervisor, and you should be seen in the emergency department only for timely care. You don't always have to be seen, and we will never force you to be seen in the emergency department. It's just that we can do your labs really quickly and they come back faster. You can always see any physician of your choosing in the event that something like this happens. If you do go to the emergency department, they should have all the appropriate forms for you. They're all also located on the internet. It just, if you type in employee packet, they all pop up. And just get those, if it's 24 hours that we like to have those forms back. If it's over in a weekend, just the next business day is totally fine. Your supervisor has to sign a few of those, so if it is over the weekend, you'll have to wait until the following Monday. Same with on-the-job injuries. If you have a slip, trip, or fall, even if it's in the parking lot, getting out of your car, please come and at least notify somebody, so that in the event that a week passes and you're not feeling well still, we can go to bat for you if it's been an extended period of time since the injury happened, like if you wanted to wait it out and see if you felt better.
Right.
Always fill out an incident report, even if it's anonymous, of where it happened, what happened. It might be something safety related, like an uneven curb or an uneven sidewalk, something that maybe we need to address, poor lighting, all of those things. So we might be able to fix some of those risks. Sharps containers, if you're in an area that uses sharps, you should have a sharps container. Almost all areas should have them. If they're full, please don't shove things in. We've had injuries by people just trying to put too much in. If they're up out of your reach where you can't see, they should be relocated so you're not blindly reaching your hand into those. And don't stick your hand inside the part to clean it either. They are key operated, so if you don't have a key, you can call security. Security can get you a key to change those in your area if you don't have one, or you can borrow somebody else's. The only other thing I say about sharps containers is be mindful of what materials you're throwing in. For the longest time, I didn't realize, like, when we do the ad vials,
Right.
that the little vial is glass, and so you should take those apart and throw it in there. So, and then things that you wouldn't normally think of that could cause an injury, if they go into a black bag, like the spike for IV fluids is sharp. And if someone can't see in the bag, they can get an abrasion from that, we wouldn't know what it was, so we'd have to treat it as if it was infectious. So if it's sharp, it could potentially hurt somebody, just put it in one of those. You probably already know about bloodborne pathogens, but so the main ones that we get concerned about are Hep B, Hep C, and HIV. Malaria and syphilis, not so much in our area, they're still up there, but those top three are the ones that we're most concerned about. Any exposure to bodily fluids, you're gonna be at risk of those. We not only offer the hepatitis B vaccine, we require it, so if you don't have documentation of that, you're probably already receiving that vaccine series, because it's the only one that's preventable via vaccine. And it also says you're not supposed to eat or drink in an area where you could be processing and handling things that are potentially infectious. So like if your working station is next to the tube system where you're packaging labs, you shouldn't have any open containers, lip glosses, things like that right there at that workstation. The highest risk for injuries are needle sticks all across the globe. Needle sticks and then splashes from procedures are the next. Obviously, they're always an accident, they're never on purpose, but one needle stick is obviously too many for us, and we want to prevent all of them, so please be mindful and careful. If you're doing an at-risk procedure, maybe ask for help. And then this isn't to scare anybody, it's no scare tactics, but obviously this is why we want everyone to be careful, is because everyone thinks it'll never happen to me, and yet it still happens around the world. So people get exposed to infectious diseases all over the world, and they are unfortunate. So the transmission risk really depends on the amount of fluid that's in the needle, the size of the needle. So if your patient had a high viral load, you were using a large bore needle and there was a lot of blood inside that, and it poked you, that is where your highest risk is. And that's how they decide what your risk is. Like I said, one exposure is too many for us. I'm just gonna, you already know about the N95s, looks a little bit different with COVID-19, and so obviously some of those things have changed. If you've been issued one, great. If you need another, you just need to reach out to me. And that goes for everybody that's gonna be watching this in the future. If you're in an area where you need a mask and you don't have one, you need to contact me. Or if you're cross-training in an area that you wouldn't normally be using one, but now you need one, just let me know. I can get you fitted for one.
I had the one. that
Yep,
you
I gave you
gave
one.
me. Yeah, I put it on my sun visor, flip, and it blew out the window.
Okay, you'll just need to come get with me.
Not accustomed to the wind yet, so.
Just come get with me. Okay, if you don't have any questions.
Good.
Thank you.
Thank you.
Thank you. Alright.